So our moderator today is Bill Wagner. After almost 20 years in human service and continually dealing with transportation as a barrier to services, he accepted the position as director of the Getthere Mobility Management Program in 2016. It was his hope that in this position, he would be able to contribute to improving the health and well-being or quality of life for individuals with mobility challenges. Since 2016, the Getthere program has expanded programming and increased the number of individuals served by 800%. And Bill has become involved in improving transportation resources at both the state and national levels. Our four panelists today include Brian Tichenor, who is the Vice President for HTM MedTrans. HTM is a transportation company serving Broome, Shenango, Delaware, and Tioga counties with ambulatory, wheelchair, and stretcher Medivan services. Brian founded HTM with local business partners possessing years of experience in defense contracting, healthcare, and commercial property services. Brian's U.S. Air Force background led him through a career in consumer technical services and fleet management before establishing HTM. Regan, who is a Medicaid field liaison for medical answering services, is a SUNY Oneonta State graduate who majored in social work and psychology. After graduating, she worked for Otsego County as a Medicaid caseworker, which really helped her build her foundation and knowledge of the Medicaid program. She has been with MASS for 8 years. Julie Feheley, who is a mobility and transportation advocate for the Getthere program, a division of Rural Health Network, has a passion for helping those most at risk overcome barriers to health care. And finally, Amber Simmons, who is a regional transportation educator and project manager for Move Together New York, a project of Cornell Cooperative Extension Tompkins County, is focusing on identifying and facilitating solutions for cross-country transportation, particularly related to healthcare and employment. So welcome to Bill and all of our panelists. We're very excited that you're here today to conduct this panel with us. And Bill, at this point, I'm going to turn it over to you.
Thank you, Georgia. Before I start, often I'm asked to talk about transportation and mobility issues, and I like to start by asking the audience to imagine, we take transportation, I think, often for granted. Imagine if you couldn't grab the keys off the counter, walk out the door, jump in your car, and go meet your health care or other needs in your life. How would things be different? What are the challenges that are presented by not being able to do that? What about those people who can't do that? How do they handle and meet their healthcare needs and that? And then, has COVID changed that? Has it made it more difficult for those individuals who need assistance in transportation? So today we have a broad variety of people with different experiences, different levels of activity for transportation during the COVID crisis. And we're going to hear from each of them about their experience, their challenges, and the changes that they made to their everyday work. So I think we'll start with our first question. Just a quick introduction of yourself and tell us a little bit about your role in transportation and healthcare. LeslieAnn.
Let me unmute myself. So yes, my name is Regan. I'm the Medicaid field liaison from MAS, and how COVID has affected MAS. MAS is still currently, operating. We're contracted with New York State Department of Health, so it's their rules of the road, so to speak. It's their program. So there's, we were still going through COVID. Obviously, trips volume has dropped when we were first experiencing COVID due to teledocs, telehealth, things of that nature. But now we have seen increase in transportation. Some of the transportation providers that we do wellness check-ins throughout the pandemic, some did unfortunately have to pull out of the Medicaid program, just not being able to survive with the low revenue. But a majority of them were able to survive during the pandemic with our daily check-ins and how things are going and whatnot. As I said, we have seen an increase of transportation trips now that we've kind of seen some light at the end of the tunnel. Obviously, the cleanliness, sanitation policies that DOH has put in place through the pandemic, currently now still are in place, as well as multi-loading. Multi-loading was prohibited during the pandemic. DOH, New York State Department of Health, has lifted some of the multi-loading requirements. All those policies, requirements can be found at the top of our public website, which is medanswering.com, in orange at the public website with all the DOH transportation guidelines. But, I think currently right now where we stand with transportation is the lack of drivers. They have the resources, they have the vehicles. It's finding the drivers to man those vehicles. And I'm talking small companies to very large companies. They just can't find the drivers, the employment right now, no matter what they offer as far as incentives, whether it's sign-on bonuses or wages or anything of that nature. That's the barrier right now that they're facing across the state.
Thank you, Leslie. We'll next go to Amber. Amber, what is your role in transportation and healthcare, and what have you seen?
Sure, thanks, Bill. So my role is the Move Together New York program doesn't provide direct transportation, but my role was really to bring transportation providers together from across the state. And what we did was support, discuss, and troubleshoot some of the common issues during the pandemic. Part of what I did is also research some of those issues for providers, as most of their time was caught up in basically crisis management of the moment. So I found there was a lot of commonalities around the state. So I thought by bringing people together, we could start to learn from each other and try to work through kind of this uncharted territory.
Thanks, Amber. Next, we'll ask Julie, your role and what you've seen during COVID.
Sure. Our role was more unique. We spent a lot of our time trying to help our clients feel comfortable with getting to their appointments. Obviously, there was a lot of fear in the beginning. People wanted to stay home and, not go to the doctor. So that was part of our role, was to help people feel comfortable finding and then troubleshooting our transportation options, because obviously we didn't have as many options at that point. We couldn't use the bus system, or people weren't comfortable with the bus system. The restrictions with the number of people in vehicles, the number of drivers that didn't feel comfortable with it. So that was, in the beginning, was trying to get people comfortable with still attending their appointments. And then when the vaccine came out, helping them get to their vaccine appointments so we could get those vaccination rates up.
Thanks, Julie. And we'll wrap up our first question with Ryan, the best for last.
Hi, I'm Ryan, the Vice President of HTM MedTrans. We're a local transportation provider in Broome County, and we also serve Shenango, Delaware, and Tioga counties. And our role throughout the pandemic was, as you've heard, survive first, and second, find a way to serve clients in a new, safe way. And to do that, we implemented several cleaning and sanitation practices. We also limited, went down to single loading, and also figured out how to continue the conversion to an all digital platform so that we could continue to serve social workers and unit secretaries and discharge planners throughout our community. And to do all this, we partnered with UHS, Lourdes, USGNY, which is the parent company of facilities like Bridgewater, Absolute, Vestal Park, and then a few other nursing facilities to find out what their needs were and to meet the greater client need.
Thanks, Ryan. We are trying to involve the audience, and we do have a couple poll questions we're going to ask. So I think if we could do our first poll question now. See if this works. What is your biggest challenge related to transportation to healthcare? Feel free to check a box. And if there are no challenges, you can dismiss yourself from this program. Just kidding. And it looks like availability is the greatest challenge. And I certainly, in my experience and the people I've talked to, I think, Leslie touched a little bit on the drivers, the lack of drivers. Ryan has mentioned it as well. I think we definitely are seeing that. It is interesting to me that cost came in last, though. That's kind of a surprise to me a little bit, but I'm going to quickly follow up with one more poll question before we go on to our next panel question. And what we really want to do is see who, oh, nope, that's the wrong one. How about the question number 4? The fourth one I sent. We really want to see with the population of, the providers who are here. Are you working mostly with Medicaid, Medicare, seniors, individuals with disabilities, or you're not really involved in that? So if you could just check one of those boxes. I feel like I should have some game show music or something during that. So the top answer was people dealing with the Medicaid population. And I think, again, a lot of times that is the population that is struggling the most with transportation and that. So thank you for participating in that. And we'll go on to the next question. We'll reverse this and I'll let Ryan go first. What changes have you seen in the environment with either your clients that you're transporting or the places, the individual, the areas you're transporting to?
Yeah, so the environments have changed drastically. When we walk into a hospital on a unit, a lot of times we'll see quarantine rooms where they have negative pressure, and you see either double masking or masking with face shields. The environment inside the vehicle even looks different. It's a much cleaner vehicle as the vehicles are getting cleaned before a client comes in and after. The equipment gets cleaned. Everything gets sprayed with a Victory disinfectant spray machine. The environments that we're picking up in doctors' offices, we're seeing fewer patients in the rooms, but somehow we're also getting more transportation requests than we have capacity to handle. So the facilities definitely are doing a great job of spacing people out and keep giving people their own area and staging people in. But we are definitely, we know there's a lot of people that are at home that there's just not enough vehicles and personnel for us to get out to them. And we're currently strategizing on how to purchase vehicles as there are vehicle shortages. Ford stopped manufacturing for a considerable amount of time. And so now all transportation providers are fighting over auctions for these vehicles, where a year ago we'd pay $30,000 and now we're paying $50,000. And we're also fighting over employees, not between local transportation providers, but we're fighting for them to come off of unemployment insurance. It's been very difficult to motivate people to, even if you're giving them the same amount of money that they're getting on unemployment, why would they want to put an effort in to get the same amount of money? So we're fighting, we're kind of fighting DOL policies, if you will. But yeah, that's the way the environment's changed.
Thank you, Ryan.
Of course.
Julie, would you like to chime in on that?
Sure. So one of our biggest challenges was maintaining the foundation of mobility management, while also ensuring that all of our clients felt safe and comfortable with their options. We did end up doing, like I said earlier, we had a lot of people that were a little nervous about public transit. So we did end up having to do a lot of cabs in the beginning. There's also the restrictions to number of people in vehicles, which made it more expensive, and it made the availability much lower. And with the higher need and lower availability, the cost went up. And then we also had things, people were in quarantine, so people needed help with groceries and prescription pickups. So we ended up doing a lot more of that. Those roles increased. So we kind of expanded our areas a bit.
Thank you, Julie. Amber, do you have anything you'd like to add to that?
Sure. So some of the challenges that I saw across the region, there seemed to be like a snowball effect going on across the Care Compass region. There was reduced ridership on transit, reduced ridership everywhere, which led to staff reductions, which meant reduction in service. Those agencies who rely primarily on retirees lost all or almost all their drivers. So therefore there was a reduced access to all the medical appointments, no matter what the reason or who the population was trying to get someplace. And you can see the additional challenges for the Medicaid population or the transportation challenged. For instance, like Chemung had to temporarily close their transportation center where all the buses meet and congregate, where riders connect to their buses for their appointments. Rarely is it a one bus option to get to an appointment if you're reliant on transit, which meant if they were already sick or vulnerable populations, they couldn't get out of the weather, there was no place to sit, making it a little more difficult to go. Or if conversely, if it transitioned into summer, it was 90 degrees heat and you had no place to get out of the heat. So there was just this snowballing blanket effect across the region for struggles for drivers, struggles for service, and layering additional challenges onto people who already have a difficult time getting to their appointments.
Thank you, Amber. And Leslie, what changes did you see in the environment?
In the very beginning during the pandemic, it was definitely a decrease in transportation. The telehealth was in full swing. Dosing was only being sent home instead of seeing regularly. So that significantly impacted transportation as well too, because they go more regularly every single day. So that impacted quite a bit. Specialty services, elective service surgeries and stuff went away. So that those transportation trips weren't there. Enrollees were nervous and scared to go out. So they just stopped going, canceled their appointments. some of, like I said in the beginning, some of the smaller transportation companies just couldn't survive with the low amount of trips, and the cost of still sustaining transportation was still there, even though the trip volume wasn't. So they weren't able to continue on. Now, fast forward where we're at now, we are seeing increase of transportation, increase of trips. Enrollees are going to their appointments. The electric surgeries are there. Mental health, Suboxone, they're going now regularly. So we see that increase of transportation. But stated earlier, now it's the lack of drivers. My big companies that have certain, we call them PPO, provider opportunities with certain medical facilities, they're just having a hard time getting the drivers. You know, they can only work their drivers for so long. And they have incentives out there, you know, $1,000 bonuses, sign-on bonuses, you know, this many wages. But what I'm hearing on calls, on PPO calls, and, you know, when we do the health and wellness check-ins with transportation providers, it's that they can't compete with the bigger companies like UPS and FedEx right now, and unemployment. So I think that's where our biggest barrier with transportation that we stand with, you know, with MAS, you know, in New York State Department of Health. And we do regular check-ins with DOH to see, you know, where it is that they want us to guide us, you know, with this concern that we have, that, you know, transportation providers are coming to us. So, you know, right now we're, you know, kind of working together collaboratively, figuring out with the transportations, with DOH, you know, what do we do now with that until, you know, they can get drivers. So that's the biggest problem we're facing right now in our world.
Thank you, Leslie. Can we do our poll question number 2 now? Did you find scheduling or finding transportation options since COVID more challenging, equally challenging, not as challenging, or not involved in transportation? Wow, that's shocking. More challenging, huh? I think we've heard from the panelists that you know, the number of options have been significantly reduced, difficulty in drivers and all of that. So that's not a surprising answer at all. Going on to our poll question, or back to our panelists. What changes to your service, if any, did you make during the pandemic? We'll start with Leslie.
Obviously, most of our changes all have to be okayed or, you know, pushed down through by Department of Health because it is their program. So we did see a lot of changes, like I stated before, of the multi-loading. You know, that was prohibited during the, you know what I mean, the initial pandemic. Currently, I would say in the last couple of weeks, that has been lessened each time. Again, those guidelines are at our public website at medianswering.com. At the very top, you'll see those. Obviously, still the sanitation, cleanliness is still full force. Masked, things of that nature, that's all still in effect. As far as scheduling, flipping it to the medical facility side of things, we are doing a lot of outreach to medical facilities that have standing orders at their location. So dialysis, mental health, Suboxone, those kind of things. Outreach to do vast wide trainings on how to utilize the MAS system to be able to schedule transportation online, because we know that their time is valuable, and you know, this is a crazy time right now. So we've done a lot of those in the beginning. We currently are still doing them. So just really getting out there and educating how to do everything online versus having to call in, because it just allows for a speedier process. Versus, you can multitask. Things can be done a lot faster online. We have our 2015 and 2020 forms, which are New York State Department of Health forms. I'm sure everyone on the call is familiar with those. The 2015 form is the upgrade of modality of transportation. So from public transit to taxi to wheelchair, so forth. Those forms need to be completed to have that upgrade to suffice for the cost difference. Those forms can be done online. And the 2020 form, which is out of the common medical marketing area. So if they need to be seen outside of their CMMA for a specialty service that's offered locally, then that form needs to be filled out. Again, that can be done online. We've really driven everything electronically just because it's less error, less human touch, less error. So those are out there. So that's what we've done in our world for both transportation and, for medical facilities.
Thank you. Amber, besides attending a lot more Zoom meetings, what changes have you occurred?
Sure. So the things I've seen in the partnering agencies that I've worked with is a lot of the transit agencies went fare free, which initially it was a safety thing, less touch, less interaction between people, but it also removed the financial burden for a lot of those folks, which was quite helpful. Some agencies changed their fixed route services, if it was transit, to an on-demand service, if it was lower volume routes. Some of the agencies suspended all or some of their service for a time, which, although some of them were fare free, they suspended service that further isolated people who were already having issues. I know in one case in Tompkins County, they completely shifted a pilot program that was supposed to get people in outlying areas to a bus stop to bring them into Ithaca. And that shifted completely to an on-demand service on weekends, getting people place to place versus a fixed route on that particular route. So there was all kinds of shifting, transforming. Volunteer drivers, most of the ones I'm aware of, shut down for a time frame. And I do know a lot of them are operating again, but just like Leslie said, and everyone else, drivers are a problem, even in the volunteer pool.
Thanks, Amber. Ryan, do you have anything you would like to contribute to that?
Of course. So just to start with the beginning of the company, we started with a digital dispatching system before all this began, and we didn't realize how crucial that would be until COVID came. COVID presented a new challenge for us, though, in that we also needed ways to communicate with our partners better. So we went to a lot more email and fax and phone calls for receiving orders. During COVID, we, like I said, we had to implement new cleaning measures. So we partnered with UHS hospitals, and they basically gave us, this is how we clean a room, and this is how we would like your vehicles to be cleaned as well. So we were able to increase our driver skills on proper sanitation. And an additional challenge that it brought was now there's new types of trips as well. It's not just medical appointments, but it's also getting out there for vaccination appointments. So not only are we keeping up with all the original things like hospital discharges, medical appointments, elective surgeries, and follow-ups, but now there's also new vaccine appointments, and we're also starting to get more requests to go to pharmacies, which is a great thing, because our clients have always been asking, hey, can you stop by the pharmacy? And we're like, our hands are tied. DOH says, we can only go from point A to point B, but now DOH starting to add in some of these things. It's great that we're able to do that. And we hope that we see it takes more time. It's an extra stop. So we hope that we see updates to the rate, or adding in new rates to add on to these trips, because the overall ask of the transportation providers has grown, but the actual remittance has remained the same. So it just puts a disadvantage there, that another barrier that we get to overcome as a community together. So we're hoping that participating in events like these, raising awareness, will help all of us work towards the goal of creating a sustainable transportation force throughout our state. You're on mute.
Said, thanks, Ryan.
Of course.
Julie, do you have anything to add to that?
So one of the things that we did was we really expanded our services to other areas that needed more assistance. So one thing that we did, we were able to partner with the residents of Tompkins County to bring them to Broome County when the vaccine came out, so that we could increase the vaccination rates. Another thing that we didn't do much of before the pandemic was food delivery and assistance and prescription assistance. So whether someone was in quarantine or they just felt uncomfortable going to the grocery store around people, that was something that we mostly used our voucher program for, but this really expanded it. And then having to look creatively at finding more options for people, because but prior to this, we had really promoted ride sharing and coordinated trips, and that wasn't really an option at this point. So looking to find some more creative solutions to get people where they needed to be was a big change for us.
Thank you. And the next question I'll just throw out to the group, to anyone that might want to answer. Of those changes you just talked about, do you see yourself maintaining those changes as you go forward? And if so, how do you plan on making that sustainable, if you have that answer?
I can jump in on this one.
Thank you.
We certainly see these changes as an improvement to our services, not a burden. Although the challenge seems burdening at the time and for over the last year. So we intend to sustain them, but our short-term solution to that is, we have limited influences over what DOH is able or willing to offer in remittance. So what we do is, unfortunately, we pass the increased expenses along to self-pay clients. So people who are on Medicare or self-pay private insurances, their rates have gone. Also, we've renegotiated some agreements and are currently renegotiating other agreements with our healthcare partners, because these are the accounts that we actually do have control over and influence. And our healthcare partners certainly understand that if transportation isn't available, or even 30% decrease in community transportation occurs, that it affects their overall mission as well, because access to care is a great percentage of it, because if you can't get a person there, you cannot bill for a service, right? So yeah, we're going to maintain this increase in quality and this increase in cleanliness, and we're hoping for more multi-load opportunities with less restrictions and a healthier community. But we also have to find creative ways to increase our revenue from our healthcare providers and private clients.
Thanks, Ryan.
Yep.
Leslie, Amber, Julie, do you have anything you would like to add on to that as far as maintaining those changes?
I think from MAS's standpoint, as far as, guidelines and policy changes, that really has to come from DOH, and, rate changes, as Ryan was talking about, those really stem from DOH. As far as MAS's standpoint, continuing to make those program enhancements to make it easier as much as we possibly can. We can't force transportation companies to open longer or increase their trip capacity or service areas more than what they can handle. But as far as making it as easy as possible and seamless as possible for the medical side of things, caseworkers, social workers, medical staff, scheduling transportation easier. That's what we're trying to do the best that we can with our programming team. So I think we'll continue on with that, and we're doing enhancements not only for the medical side, but for the transportation providers too, with their, what they see and, different features that they've been asking for a long time are starting to roll out in the next month or so. So you'll see those as well. So we're both working on both sides as much as we can with what we're able to do. And then, hopefully long term we can see that the staffing that they can have, the drivers, just increase so we can get back to, not having that shortage, that barrier for transportation. That's it.
Thank you. Amber, Julie, anything you want to add?
So I do know from, in particular, Schuyler and Chemung counties, just by doing a survey of their riders, they've reported that they intend to continue to do the enhanced cleaning protocols that they established during the pandemic. Riders in general appreciate the cleaner buses and the effort that's going into making sure that they're clean, even though, ridership is still down. They're working on growing that back up to pre-pandemic levels. But the riders appreciate that extra effort that's going into that. How they sustain it, there is some funding that has come across that could help them sustain it, at least in the short term. I'm not sure what their long-term strategies are going to be. And I also know that, like Tompkins, for the pilot they were looking at, which was to take people from homes to bus stops and into Ithaca, the way people wanted to use that service, they're actually looking at replicating it in another area of the county where it's more of an on-demand type of service. Yes, it will take you to a bus stop, but it will also take you to, say, places within Dryden. If you want to do your grocery shopping at the local store and get your stuff at the local place, you're not going to have to go to a bus stop and go to Ithaca from there. So there's been some good things that have come out of it as well.
Thank you, Amber. And Julie?
Sure. So like I mentioned, the food and prescription assistance, that was something that the need greatly increased during the pandemic. And that's something that we've discovered has, continued to be an issue for people, especially with, people aren't working necessarily, or there's other issues going on. And we have found that there is this need, and it is a continuing need. So we are still continuing to work towards meeting that.
Thank you. Could we go to our final poll question? Since COVID, I have seen an increase in transportation expense, no change in transportation expense, a decrease in transportation expense, or not really applicable.
Bill, you're on mute.
My mouse isn't working. There you go. Thank you for the polls and that information from all of those questions we'll be looking at, and that will be helpful in going forward. We're going to begin to wrap this up before we turn it over to questions from the group. So I'm going to give the panelists one final question. We've heard from each of you today that, the challenges. I've spoken to providers around the state and even some, at the national level about their challenges. the lack of drivers, the operating costs, the increasing cost of fuel and insurance, the economic recovery, how quickly are we going to get people returning to work from unemployment, and all of that. All of this, I think, is leading to, a potential transportation to healthcare crisis. We've made improvements in the system, but the system has gotten smaller. It's reduced. The capacity to serve is reduced. If you were to offer one suggestion or two suggestions on how we can avoid this transportation to healthcare crisis, what would it be? And I'm going to go to Ryan first because he's just looking antsy to jump onto this. So.
Oh yeah, I would say this is probably not a wider transportation idea, but I would say to include medical transportation into more of a public transportation service. For example, our company is located directly across the street from Broome County Transit, and it seems that if a medical transportation department was ran out of a public transportation division, that it would normalize the costs. It would increase availability through government funding, and it would also provide consistency across transportation, because you can go from our provider and then get into a different minivan with a different provider, and there's going to be a different level of quality of vehicles, different level of quality of drivers. So if you had a standardized policy regimen, to determine what types of vehicles are going to be used to transport people, what kind of qualifications are going to be required, and that was backed up by government funding, I think you would have a much better, much more reliable and high quality, predictable transportation system.
Thank you. Amber, would you like to weigh in on that?
Sure. Particularly in the rural area, when I thought about it, would be to increase the supply of transportation, which means two different levels: either A, buying more vehicles and supplying the rides in some sort of coordinated manner, which there was a system, the ARNET system in Chemung County kind of went that route prior to the pandemic, or healthcare putting some additional dollars into the existing system and helping the transportation professionals by increasing the supply of the rides itself. So they don't have to be experts in everything, but putting some additional dollars into those programs to help coordinate what's there, and then looking at increasing the capacity from that level.
Thank you. Leslie.
I know I'm up, so my role is a little different as far as what I can say, how to increase it. I think I touched on it before. Obviously, the hopefulness of seeing an increase of drivers to be able to man the trip capacity volume that's out there currently right now. It's hard for me not to touch too much on what ifs in the future with DOH, and what their thought process is as far as the Medicaid program. So I know the higher ups at MAS, the VPs, and their calls with DOH, the wheels are always turning. So I think that there will be some changes and some positive changes to that. So I think good things are coming. I think that we will see some things that everyone touched on come out to light. So, we'll just have to wait and see. I mean, it is New York State Department of Health program. So we kind of just have to follow the rules of the road, so to speak, right now with what we can do, and what MAS can do as far as program enhancements, and try to just serve our population as best as we can. So that's as much as I can say, I think.
Thank you. And we won't breathe a word of it to DOH. So
yeah.
Julie.
Sure. I think on just a very basic level, continuing our preventative measures. I know a lot of cab companies have put in plexiglass in their vehicles. We've made such strides in cleaning and sanitation. If we can just continue doing that, I think to help reduce the amount of like spreading of disease that there is. If we are able to expand service to other areas, we could reduce crowding on public transit or in taxi cabs. So I think just those basic, like the sanitizing and cleanliness and wearing masks if you don't feel well, which I know probably isn't a popular opinion, but you know, just those basics to minimize the spread of disease.
Thank you, Julie. And I would just like to first, before we open it up to questions, again, thank Care Compass for putting this together. I do believe that this is the start. If we look at this transportation to healthcare ecosystem, the healthcare providers, the insurance, the transportation providers, mobility managers, we all have a part, and we need to work together, coordinating and collaborating and building on that. So again, I thank Care Compass for starting this and initiating this conversation.